We put a lot of trust in our doctors to figure out what's wrong with us. But what happens when they get it wrong? Today, we're going to pull back the curtain on a hidden crisis in healthcare, diagnostic error. It's a problem that unfolds behind closed doors, often with absolutely life-altering consequences. Just think about that for a second. We focus so much on preventing diseases like cancer or heart disease, right? But what if the single biggest threat to our health is the diagnosis itself? The reality is, the scale of this problem is, well, it's almost unbelievable. Okay, get ready for this number. Every single year in the US, nearly 800,000 people are either seriously harmed or permanently disabled by a diagnostic error. That's according to a landmark report from Johns Hopkins. This isn't some rare one-off thing. It's a massive public health crisis hiding in plain sight. And it's not just about getting the wrong diagnosis. Sometimes the real problem is getting no diagnosis at all. Take something called mild cognitive impairment, which can be a precursor to Alzheimer's. A recent USC study found that 90%, that's 90%, of the 8 million people who have it are completely unaware. That's over 7 million people missing a critical window for early intervention. And this problem of underdiagnosis, well, it hits certain groups way harder than others. For example, it's estimated that a staggering 75% of women with ADHD are never, ever diagnosed. So let's look a little closer at who's being missed. We're going to start with that huge gender gap in ADHD diagnosis and the stories of these invisible patients. So why are so many women being missed? Well, it turns out the diagnostic criteria for ADHD were pretty much created based on studies of young boys, and their symptoms are often what you'd expect: hyperactive, disruptive, external. But girls, on the other hand, tend to internalize their struggles. Their ADHD looks more like inattentiveness, being lost in thought. They get really good at developing coping mechanisms to mask their symptoms. And because they're not causing trouble, they just get overlooked. This creates this incredible ripple effect. A psychiatrist from Chicago shared this story that really hits home. She said that often when she diagnoses a child, one of the parents quietly recognizes the same patterns in themselves. For so many women, it's the very first time they see their own lifelong struggles in a new light, finally understanding that maybe something wasn't wrong with them after all. And this isn't just about gender. The same patterns of being overlooked, of being misunderstood, they play out across racial and socioeconomic lines, creating these huge disparities in who gets an accurate and timely diagnosis. We see this so clearly with autism spectrum disorder. Children of color are often diagnosed years later than white children, not because their symptoms are different, but because they face this wall of systemic barriers. We're talking about everything from implicit bias and a lack of provider training, to financial hurdles, cultural stigma, and a deep-seated and often totally justified distrust of the medical system. These individual stories really point to some deep systemic flaws. So let's pull back for a second and look at how these flaws lead to the most serious and widespread harms across our entire healthcare system. That same Johns Hopkins report found that 75%, 3/4 of all serious harm from misdiagnosis, comes from just 3 categories of illness. They call them the big 3: vascular events like strokes, common infections, and cancers. And these are not rare, obscure diseases. Look at the top 5 most commonly misdiagnosed conditions that cause serious harm. Stroke is at the top, missed nearly 18% of the time. And the others? Sepsis, pneumonia, blood clots, and lung cancer. These are common, and for every single one, a timely, accurate diagnosis can be the difference between life and death. Okay, so a problem this complex, rooted in both human error and systemic bias, it requires some really innovative solutions. And one of the most promising new tools in public health works by bypassing the individual diagnostic process entirely. It's called wastewater surveillance. It's actually a pretty simple concept. Our sewage contains genetic material from everything that's circulating in a community. So by testing it, public health officials can get a real-time snapshot of population health without a single person needing to see a doctor. The process is really straightforward. Wastewater gets collected from treatment plants and sent to a lab. There, it's analyzed for genetic material, and the data is reported to the CDC. From flush to finding, the whole thing takes just 5 to 7 days, giving us this remarkably fast and efficient health report for an entire community. And the real power here is that it sidesteps nearly all of the barriers we've been talking about. It provides an early warning of outbreaks, it's totally independent of the medical system, and it doesn't matter if someone has insurance or transportation or access to testing. It captures data from everyone in the community, giving us an unbiased look at what diseases are really spreading. Now, system-level tools like wastewater surveillance are absolute game changers. But for each of us, right, getting a diagnosis is still a personal journey. So let's shift our focus back to the individual who's trying to navigate this really complex system. So, thanks to more open conversations online, awareness of conditions like ADHD is at an all-time high. A recent survey found that a quarter of all adults suspect they might have it. But here's the catch. Only about half of them have ever actually talked to a doctor about it. And that brings us to a really critical point. While all this increased awareness is a huge step forward, self-diagnosis can be dangerous. So many conditions have overlapping symptoms. Anxiety and depression, for instance, can look a lot like ADHD. And getting the wrong treatment, like a stimulant for what is actually an anxiety disorder, can make things significantly worse. A professional evaluation is absolutely essential. So we're at this strange crossroads. We have more health information at our fingertips than ever before, which is incredibly empowering. But that same flood of information can also be really misleading. So the ultimate challenge is this. In a world of endless information, how do we find the one thing that truly matters, the right diagnosis?